when?
You go ahead whenever you're
Okay.
ready.
All right, so this tutorial is going to be on rib release. It's a big thing that clients are very impressed with. And it's super easy, and it's going to be kind of a quick training. So, if anyone else has techniques on rib release, please feel free to share afterwards. So, typically when you get a client and you do that first verbal assessment and you ask where they have restrictions, more often than not, somebody's not going to typically come in and say, oh, this rib, I think I have a rib out or something like that. That's not what they assume is going on. So the symptoms that somebody might have is painful, sharp pain while breathing, sharp pain near the spine while moving their arms around, or limited mobility in their neck, painful movement of the neck. Those are common symptoms for rib restrictions, but they're not the only ones. There can be many others. So the way I start most of my sessions, just because this kind of addresses a wide range of restrictions, I always start with my forearms on either side of the spine, right in the belly of the erector spinae group. And if I knew my chair better, I would have raised this a little because it's a little short.
We can.
But we're good. Okay, so I have my forearms on either side of the spine, and I just wait for her breath. If your client is breathing kind of shallow and you don't feel it, you can call for breath. But I just wait, and I'm feeling where the breath is moving. Is it moving up towards her head? Is it moving down her spine? Is it moving sideways? And where is it not moving? Is it in one side of her spine but not the other? So I'll wait until I make that assessment. It takes maybe 2 to 3 breath cycles. So in Janelle, she has pretty good breath, but I'm gonna guess, because of the limited motion of her breath, that there's more restriction on this side. So then I'll do some compressions down the spine, and right now I'm feeling for a rib restriction. Now what you might feel is, so ribs, they lay generally pretty flat like this, and then when you breathe they move like the Venetian blinds, like this, up and down. So if a rib is stuck, it's going to be sideways like this, and you might feel a sharp edge similar to the blade of your forearm. It's going to feel kind of predominant comparative to the other ribs, and you're going to feel a sharpness, like an edge. So what I do if I find a rib, and I'm not finding anything particular on Janelle, but I'm going to pretend. So I'll find that little sharp piece of rib, and then I'll give it a spring test. So a spring test is not like a bounce like this, and it's not anything where you'd see your client move. So it's not that either. Sorry, Janelle.
That's all right.
So what it is just a little bit of weight in and then a back off. And what I'm trying to feel for is, does this rib spring? Does it move? And if it does, you can test the one above it or below it just to compare. Is it moving? Is it not moving? Is it moving just as well? And so if you determine, yeah, that rib doesn't move as good as the one above and below it. So then I would ask my client, is this a tender spot for you? Does this have a quality to it? And more often than not, they're going to be like, before you even ask, while you're pushing, they're going to be like, oh yeah, that hurts, that's a good spot. Or their answer could be, no, I don't feel anything. So if a rib isn't painful and it's just in this position, then more than likely it's not stuck, it's just in this position and it just moves differently. And if that's the case, don't worry about it. We don't care if things are nice and flat and pretty, we just care if they're moving. Okay, because movement is medicine. So we don't want to just like jam her rib back into a spot where it's not used to. So she's like, yes, there's pain, and you can determine it's not moving. So the next thing to intervene is, so you want to determine, is it stuck open or is it stuck closed? 9 times out of 10 it's going to be stuck open, but either way you have a 50-50 chance of guessing. I can go over a whole spiel of how you can really determine, but in a chair massage you don't have really that much time to do that much of an assessment, and the client is going to be like, stop assessing me, just massage me. So a quick intervention for this is you would take the client's arm and you would place it on your own leg like this. And you say, just let your arm be heavy right here. So you just want their arm to line up with their side, okay? Doesn't really matter of the position, rotation. I prefer elbow out, but that's just me. And then I'll find that restriction again, and I can either use fingertips or elbow, and you don't want to do this. I'm doing this for camera. You want to be more here or here, just whatever your body mechanics likes to do. So I'm on this rib, and I'm giving it just some pressure, and then I'll instruct my client, Janelle, I want you to take a deep breath in, and then on your exhale, I want you to blow out your birthday candles and reach down to the floor with your arm. And that's going to compress the ribs closed. And now take a breath in, and then you're going to encourage the opening of the rib, and then do one more of those. Out, reach, 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 reach. More breath out, and breathe. And rest. And you can shake out her arm and put it back, and then reassess. Like, is it still there? Is it moving? How does that feel now, Janelle? Does it feel amazing that your rib that wasn't stuck is now unstuck?
It feels amazing.
Good. Okay, so that's a quick intervention for it. Now, if the rib was stuck closed, so let's say you did that and it didn't work, like, oh no, it still hurts and it's still not moving, so you could do another intervention where you place the client's arm above their head like this. Now, only do this if their shoulders are happy and healthy, and you'll learn that in your verbal intake. So you've got it this way, and you'll take your client's hand like this just as a support, and then you'll say shallow breath in, and big breath out, and big breath in, and then you'll just apply some pressure, and then rest. That one doesn't happen very often. More often than not, they're closed, they're stuck open. But that's how you would do a stuck closed rib. Okay? So those are the two main interventions, quick interventions for a chair massage for a rib. Now for the first rib. So you'll have your client sit up and place their hands on the chest rest for support. The first rib is when a client feels like they have a stiff neck, they can't move it very well, and when they do, it's painful. So the first thing that you want to look at is the trap area, and is one higher than the other. So you'd kind of eyeball and assess, be like, it's a little higher than the other. Now if somebody has a rib that's like up here, then that's not your scope of practice, okay? That's actually something like a cervical rib or something like that. But if it's just slightly above, then what you want to do is instruct your client to do a shoulder roll, move your shoulders up and back, and rest your scapulas or shoulder blades on your spine there, your rib cage. And let your scapulas just kind of melt down your back. Good. And now I've got her traps, and I'm just kind of peeling them back. And I might do a little finger compression, grab those traps, and peel them back. Okay. And then walk your fingers a little bit forward, and now you're gonna feel those first ribs. So I'm doing just a little spring test side to side, and her first rib is awesome. They're both springy, they're both happy, healthy first ribs. But if there was one that was stuck, one would be bouncy and one would be not bouncy. And that means it's a stuck first rib. So that first rib, if it's higher, scalenes could be pulling it up, right? So some scalene work, soften the scalenes, but again, you want to be really gentle. You don't want to mash on these things because there's that big bundle of nerves back here called the brachial plexus, okay? And nerves do not like to be mashed on. They like to be treated nice. So you'll do some of your own scalene work, get that all done, and once you've assessed those scalenes and gotten them nice and soft, you can either, depending on who you are and who your client is, you can get back on that rib with some finger pressure, or you can drop an elbow, but if you do, make sure that it's gentle, and keep in mind that the harder you press, the less you're gonna feel, and you need to feel this rib move. So I'll instruct Janelle, or your client, to tuck your chin into your chest, give yourself a double chin, and now let your eyeballs fall down to your lap. and your head to fall down a little bit more. Good. And now let your eyes rotate your head to look at your knee on the same side. There you go. And then just kind of hang out. I felt her rib move. I can apply a tiny bit pressure. How's the pressure, Janelle? Is that okay?
That's good.
And then move your eyes back to your lap and bring your eyes back up to horizon. There you go. And then reassess. Yeah. Now we got we got more movement in there. If you got, some movement or not as much movement, the next thing you can do, same thing, peel the traps backwards, get an elbow on there, tuck your chin into your chest, or give yourself a double chin, is that the same thing? And then let your head fall down towards your lap, and then let your opposite ear go to your opposite to the shoulder. Sorry, side bend your neck. There you go. Okay, so this is awesome. So your clients are going to be like, what? What are you saying? So you can even say, all right, so just down at your lap, side bend to your shoulder, okay? And you got to keep your head down the whole time, rather than looking up. Okay, so let's start over. Get your elbow in there, tuck your chin, eyes down, ear to shoulder, and that's a stretch. And then eyes back to lap, and then up to horizon. Ooh, we got a pop. That was awesome. That was good, right? And I was like, how much pressure was I using?
Not a lot.
Like none,
no,
right?
Like medium pressure.
Yeah. And then I say something cute like, chiropractic adjustments are free. No, don't say that. I'm just kidding. Don't say that.
Oh, I have this knot in my neck right there. No.
Yeah, let me just get that for you. Okay, so that's rib release.
Cool.
That's all there is to it.